Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go snag your free 31-page PDF on the top 200 drugs. Great study guide, great refresher. Simply an email will get you access to that. Definitely a no-brainer to have if you're out in practice or if you're preparing for board exams, pharmacology exams as well. So again, go check that out at reallifepharmacology.com. All right, so this is going to be part one of a little bit of a short special series here on medication errors. I'm going to go through a lot of the terminology, many mistakes, some common, some not so common. And I'm also going to provide you examples that I've seen myself in real life practice, that I've heard of happening, that I think can really help you become a better physician or pharmacist or nurse or whatever the case may be. So these are going to be important errors to look out for. What they are first and foremost, and try to give you some, common examples, some real life situations that I've come across in my over a decade now of experience as a pharmacist. All right, first one I'm going to start with is a prescribing error. So this is a mistake at the point of writing a prescription. So for instance, the provider wants to start lisinopril 10 milligrams and they inadvertently write for 40 milligrams. Maybe they were thinking about something else or whatever the case may be. Now, this is an example of something that can easily be caught if, a pharmacist, if a nurse, if somebody's paying attention and they recognize dosages, okay? So if, as a pharmacist, if you're dispensing this medication and you see a new order for lisinopril, patient's never been on it, never been on another ACE inhibitor, an ARB, or anything like that, and you see an order for 40 milligrams of lisinopril, the highest dose, that should, prompt some alarms in your head, like, whoa, this is weird, that the patient is starting that high of a dose, and it should prompt you to kind of ask more questions and make sure that that's indeed what the provider meant to do, okay? So that's a prescribing error, mistake coming from the provider on the prescription. Omission error in long-term care consulting and assisted living consulting, I see this all the time. It is the most common error. I would say it's probably, and I say this with a grain of salt, it's probably the least risky error. There absolutely can be some risk associated with it. If you miss a dose of insulin, or if you miss a dose of an anticoagulant, obviously that patient's going to be more at risk for hyperglycemia, in the case of insulin, and potentially for blood clot if we miss a dose of an anticoagulant. So failing to give a scheduled dose is what's called an omission type error. And again, in long-term care and assisted livings where I've got, nurses and TMAs and aides giving medications, this is by far the most common error, because if you think about it, it's what we do the most with medications as well. So again, generally not as significant maybe as some of the others that I'll talk about, but if it is, a particular high-risk medication, it definitely can be significant and cause some issues there. Wrong dose error, I think that's kind of common sense what that is. Example being here, if you've got a patient on levothyroxine, 125 milligrams, and we, dispense 175 milligrams, and that's given to the patient, that's the wrong dose that we wanted, and obviously could lead to complications for sure. Wrong drug error, that's probably as it sounds as well. You give hydralazine versus hydroxyzine, maybe medications that look similarly as well. That's usually the case when we have a wrong drug error. We get the names mixed up, or they start with the same letter, those type of things. And I'll talk about that further coming up here as well. But basically, administering a different medication than intended. Wrong route error, so giving a medication IV versus oral, for example, when we wanted to give oral. Not something I run into crazy often, but definitely something that can happen. I would say it's probably a little more likely to happen maybe in the outpatient setting where patients are doing their own medications. So, for instance, a suppository that's, taken orally, or, those type of situations where maybe the patient wasn't educated enough. But again, in a hospitalization setting, in an institutionalized setting, certainly there is a possibility, if we're not clear exactly what route we want to be given, that it could be given incorrectly there. Next one, wrong time error. So this is giving a medication at a time that is incorrect. Giving an antibiotic late, for example, also maybe could be, classified as an omission as well, depending upon how long it takes you to remember to give that dose afterwards. But probably the one that I see and patients have the most concern about is in Parkinson's disease, particularly with chronic medications. With Parkinson's disease, that Sinemet can be really, really touchy as to when it's given. And so if the patient, wants it at, 6 a.m., 10 a.m., and 2 p.m., and we get delayed a little bit, patients can start having symptoms of their Parkinson's disease, and it can be really problematic, lead to, discomfort, falls, and a whole bunch of negatives there with that situation. So, timing on something like Sinemet is really, really important. There's certain birth controls, like progesterone-only pills, that are pretty sensitive to that timing and administration as well. And again, giving medications at the wrong time here can potentially lead to issues. Unauthorized drug error. Occasionally I see this in the long-term care assisted living world, where we actually didn't have an order from the provider, but the medication has been given. So, oftentimes it's a discontinuation order example. So if a PRN has been stopped or discontinued and that order was missed, and now we're still giving that, but we don't actually have an active order for that medication. Not crazy common that happens, but when we have multiple providers and those type of things, that can sometimes cause confusing situations for staff in making sure that we get all those orders correctly, and obviously relaying that information to the folks giving the medications and making sure that the order list, the EMR, all that's up to date. Monitoring errors. So this is definitely something that I see periodically as a pharmacist, something I write recommendations about. Hey, that provider ordered a TSH to be drawn in 3 months because we changed the levothyroxine dose. Now, 3 months later, that order got missed. So making mistakes on those lab errors can definitely be important. Now, something like a TSH 3 months later, maybe not quite as critical as, let's just say we started high-dose furosemide to run off some fluid and those type of things, and heart failure, and BMP was ordered in 5 days or 7 days after that LASIX exchange. Now we missed that lab. Now it's 2 weeks, 4 weeks later. Well, they could end up in a situation where, if that diuretic dose was too aggressive, we could be causing some dehydration, maybe acute renal failure risk, could be causing some hypokalemia that we didn't catch right away. So monitoring errors can definitely be, higher risk or lower risk, kind of depending upon the situation there, but certainly can be important there as well. One other example with monitoring that I've seen get missed is INR monitoring. So in that situation where we are supposed to be checking an INR, we miss it, and occasionally I've seen stop dates for warfarin on that INR date that it was supposed to be drawn, and In that situation, we missed the monitoring lab, and because we missed the monitoring lab, now the medication actually got stopped as well. I've seen that situation happen a couple of times in long-term care and assisted living. So really, really important to recognize kind of that coupling sometimes of orders, particularly with an example like warfarin, coupled to the lab that we're doing. Adherence error, this is a patient-specific error. Patient not taking the medication as prescribed. And this can be intentional. It can be unintentional, where patients maybe just have a busy schedule, they forgot about it, that type of thing. But it could be due to they're having an issue with the medication and they're tired of it. Maybe they have significant diarrhea from metformin, and they know the metformin's causing it, and they're intentionally skipping dosages. So while I wouldn't necessarily consider that an error because the patient recognizes there's a problem, I guess where the error would occur in my experience is, okay, well, patient, you need to let a healthcare professional know that, hey, we need to use a different medication, we need to alter the dose, we need to do a different dosage form, whatever the case may be, whatever the solution might be, right? So that would be, considered, I guess, classically considered an adherence error. But that's also indicative of, an adverse effect or a potential problem with the medication. All right, and the last one I'll cover here in part 1 is a dispensing error. So this is where a pharmacy provides an incorrect drug, dose, or label. So, for instance, if it's a twice daily drug, so metoprolol tartrate, 25 milligrams twice daily, and the pharmacy only dispenses once daily. Okay, so that would be an issue on the pharmacy side where there was errors in that, interpretation, documentation, getting it into the computer, getting it to a label, a potential dispensing error where the patient didn't get the correct drug or dose or label potentially. All right, well, that's going to wrap up the podcast for today. Thank you so much for listening. Do me a huge favor. Support meded101.com/store. Tons of resources that have helped thousands of pharmacists, nurses, and other healthcare professional students. We got books, we got study materials for things like NAPLEX, BCPS, ambulatory care, nursing pharmacology review course, tons of different resources there. Go check them all out. Your support there goes directly to help support this podcast. Again, meded101.com/store. With that said, thank you so much for listening. If you want to reach out to me, mededucation101@gmail.com. If you got any comments, suggestions, any type of feedback on the podcast, I greatly appreciate that. I try to do the best I can. Also, don't forget that free 31-page PDF on the top 200 drugs. Great little study guide, great refresher. You can snag that at reallifepharmacology.com. And if it's not too much trouble, you found this podcast helpful, do me a huge favor, leave a rating review on iTunes or whatever platform you're listening on. Thanks so much. Take care. Hope you have a great rest of your day.